Public health emergency of international concern. A public health emergency of international concern, PHEIC, is a formal declaration by the World Health Organization, WHO, of an extraordinary event which is determined to constitute a public health risk to other states through the international spread of disease and to potentially require a coordinated international response, formulated when a situation arises that is serious, sudden, unusual or unexpected, which carries implications for public health beyond the affected state's national border and may require immediate international action. Under the 2005 International Health Regulations, IHR, states have a legal duty to respond promptly to a PHEIC. The declaration is publicized by an emergency committee, EC, made up of international experts operating under the IHR, 2005, which was developed following the SARS outbreak of 2002-2003. Since 2009 there have been 6 PHEIC declarations: the 2009 H1N1, or swine flu, pandemic, the 2014 Polio Declaration, the 2014 outbreak of Ebola in Western Africa, the 2015-16 Zika virus epidemic, the 2018-20 Kivu Ebola epidemic, and the ongoing 2019-20 coronavirus outbreak. The recommendations are temporary and require reviews every 3 months. SARS, smallpox, wild-type poliomyelitis, and any new subtype of human influenza are automatically PHEICs and thus do not require an IHR decision to declare them as such. A PHEIC is not only confined to infectious diseases, and may cover an emergency caused by a chemical agent or a radionuclear material. In any case within its ambit, it is a call to action and last resort measure. Most epidemics and/or emergencies which gain public attention do not fulfill the criteria for the PHEIC to be invoked. Were not even convened for the cholera outbreak in Haiti, chemical weapons use in Syria, or the Fukushima nuclear disaster in Japan, for example. Background: multiple surveillance and response systems exist worldwide for the early detection and effective response to contain the spread of disease. Time delays still occur for 2 main reasons, however. The first is the delay between the first case and the confirmation of the outbreak by the healthcare system, allayed by good surveillance via data collection, evaluation, and organization. The second is when there is a delay between the detection of the outbreak and widespread recognition and declaration of it as an international concern. The declaration is promulgated by an emergency committee, EC, made up of international experts operating under the IHR, 2005, which was developed following the SARS outbreak of 2002-2003. Between 2009 and 2016, there were 4 PHEIC declarations. The 5th was the 2018-20 Kivu Ebola epidemic, which was announced on July 17, 2019. The 6th is the 2019-20 novel coronavirus outbreak. Under the 2005 International Health Regulations, IHR, states have a legal duty to respond promptly to a PHEIC. Definition: PHEIC is defined as. This definition designates a public health crisis of potentially global reach and implies a situation that is serious, sudden, unusual or unexpected, which may necessitate immediate international action. It is a call to action and last resort measure. Reporting of potential concern. WHO member states have 24 hours within which to report potential PHEIC events to the WHO. It does not have to be a member state that reports a potential outbreak, hence reports to the WHO can also be received informally. Under the IHR, 2005, ways to detect, evaluate, notify and report events were ascertained by all countries in order to avoid PHEICs. The response to public health risks was also decided. The IHR decision algorithm assists WHO member states in deciding whether a potential PHEIC exists and the WHO should be notified. The WHO should be notified if any 2 of the 4 following questions are affirmed. The PHEIC criteria include a list of diseases that are always notifiable. SARS, smallpox, wild-type poliomyelitis and any new subtype of human influenza are always a PHEIC and do not require an IHR decision to declare them as such. Quotidian epidemics which public attention do fulfill the criteria to be a PHEIC. ECs were not convened for the cholera outbreak in Haiti, chemical weapons use in Syria or the Fukushima nuclear disaster in Japan, for example. Further assessment is required for diseases which are prone to pandemics, including but not limited to cholera, pneumonic plague, yellow fever, and viral hemorrhagic fevers. A declaration of a PHEIC may appear as an economic burden to the state facing the epidemic. Incentives to declare an epidemic are lacking, and the PHEIC can be seen as placing limitations on trade in countries that are already struggling. Emergency Committee. In order to declare a PHEIC, the WHO Director General is required to take into account factors which include the risk to human health and international spread, as well as advice from an internationally made-up committee of experts, the PHEIC, one of which should be an expert nominated by the state within whose region the event arises. Rather than being a standing committee, the EC is created ad hoc. Until 2011, the names of PHEIC members were not publicly disclosed. These members are selected according to the disease in question and the nature of the event. The Director General takes the EC's advice following their technical assessment of the crisis using legal criteria in a predetermined algorithm after a review of all available data on the event. Upon declaration, the EC then makes recommendations on what actions the Director General and member states should take to address the crisis. The recommendations are temporary and require 3 monthly reviews. Declarations. 2009 Swine Flu Declaration. On April 26, 2009, more than 1 month after its first emergence, the first PHEIC was declared when the H1N1, or swine flu, pandemic was still in Phase 3. On the same day, within 3 hours, the WHO website received almost 2 million visits, necessitating the pandemic's own dedicated pandemic influenza website. At the time H1N1 had been declared a PHEIC, it had so far occurred in only 3 countries. Declaring H1N1 a PHEIC has therefore been argued as fueling public fear. However, a 2013 study sponsored by the WHO estimated that although the H1N1 pandemic was similar in magnitude to seasonal influenza, it resulted in the loss of more life years due to a shift toward mortality among persons less than 65 years of age. 2014 Polio Declaration. The second PHEIC was the 2014 Polio Declaration, issued in May 2014 with a resurgence of wild polio after its near eradication, deemed an extraordinary event. Global eradication was deemed to be at risk with small numbers of cases in Afghanistan, Pakistan, and Nigeria. In October 2019, continuing cases of wild polio in Pakistan and Afghanistan, in addition to new vaccine-derived cases in Africa and Asia, was reviewed and remains a PHEIC. It was extended on December 11, 2019. 2014 Ebola Declaration. Confirmed cases of Ebola were being reported in Guinea and Liberia in March 2014 and Sierra Leone by May 2014. On Friday, August 8, 2014, following the occurrence of Ebola in the United States and Europe, and with the already intense transmission ongoing in 3 other countries for months, the WHO declared its third PHEIC in response to the outbreak of Ebola in Western Africa. Later, one review showed that a direct impact of this epidemic on America escalated a PHEIC declaration. It was the first PHEIC in a resource-poor setting. 2016 Zika Virus Declaration. On February 1, 2016, the WHO declared its fourth PHEIC in response to clusters of microcephaly and Guillain-Barré syndrome in the Americas, which at the time were suspected to be associated with the ongoing 2015-16 Zika virus epidemic. Later research and evidence bore out these concerns. In April, the WHO stated that there is scientific consensus that Zika virus is a cause of microcephaly and Guillain-Barré syndrome. This was the first time a PHEIC was declared for a mosquito-borne disease. This declaration was lifted on November 18, 2016. 2018 20 Kivu Ebola Declaration. In October 2018 and then later in April 2019, the WHO did not consider the 2018-20 Kivu Ebola epidemic to be a PHEIC. The decision was controversial, with Michael Osterholm, director of the Center for Infectious Disease Research and Policy, CIDRAP, responding with disappointment and describing the situation as an Ebola gascon sitting in DRC that's just waiting for a match to hit it, while the WHO panel were unanimous that declaring it a PHEIC would not give any added benefit. The advice against declaring a PHEIC in October 2018 and April 2019, despite the criteria for doing so appearing to be met on both occasions, has led to the transparency of the PHEIC coming into question. The language used in the statements for the Kivu Ebola epidemic has been noted to be different. In October 2018, the EC stated a PHEIC should not be declared at this time. However, in the 13 previously declined proposals for declaring a PHEIC, the resultant statements quoted the conditions for a PHEIC are not currently met and does not constitute a PHEIC. In April 2019, they stated that there is no added benefit to declaring a PHEIC at this stage, a notion that is not part of the PHEIC criteria laid down in the IHR. After confirmed cases of Ebola in neighboring Uganda in June 2019, Tedros Adhanom, the Director General of the WHO, announced that the third meeting of a group of experts would be held on June 14, 2019 to assess whether the Ebola spread had become a PHEIC. The conclusion was that while the outbreak was a health emergency in the Democratic Republic of the Congo, DRC, and the region, it does not meet all the three criteria for a PHEIC. Despite the number of deaths reaching 1,405 by June 11, 2019 and 1,440 by June 17, 2019, the reason for not declaring a PHEIC was that the overall risk of international spread was deemed to be low, and the risk of damaging the economy of the DRC high. Adhanom also stated that declaring a PHEIC would be an inappropriate way to raise money for the epidemic. Following a visit to the DRC in July 2019, Rory Stewart, the UK's DFID minister, called for the WHO to declare it an emergency. Acknowledging a high risk of spread to the capital of North Kivu, Goma, a call for a PHEIC declaration was published on July 10, 2019 in the Washington Post by Daniel Lucy and Ron Klain, the former U.S. Ebola response coordinator. They stated that in the absence of a trajectory toward extinguishing the outbreak, the opposite path, severe escalation, remains possible. The risk of the disease moving into nearby Goma, Congo, a city of 1 million residents with an international airport, or crossing into the massive refugee camps in South Sudan is mounting. With a limited number of vaccine doses remaining, either would be a catastrophe. 4 days later, on July 14, 2019, a case of Ebola was confirmed in Goma, which has an international airport and a highly mobile population. Subsequently, the WHO announced a reconvening of a fourth EC meeting on July 17, 2019, when they officially announced it a regional emergency, and by no means a global threat, and declared it as a PHEIC, without restrictions on trade or travel. In response to the declaration, the president of the DRC, together with an expert committee led by a virologist, took responsibility for directly supervising action, while in protest of the declaration, Health Minister, Olusegun Okalanga resigned. A review of the PHEIC had been planned at a fifth meeting of the EC on October 10, 2019, and as of October 18, 2019, it continues to be a PHEIC. Coronavirus disease 2019, COVID-19. On January 30, 2020, the WHO declared the outbreak of COVID-19, centered on Wuhan in central China, a PHEIC. On the date of the declaration, there were 7,818 cases confirmed globally, affecting 19 countries and 5 WHO regions. Previously, the WHO had held DC meetings on 22 and January 23, 2020 regarding the coronavirus outbreak, but it was determined that it was too early to declare a PHEIC at that time given the lack of necessary data and the, then, scale of global impact. The earlier decision not to declare an emergency was criticized by Peter Pio. Response. In 2018, an examination of the first 4 declarations, 2009 to 2016, showed that the WHO was noted to be more effective in responding to international health emergencies, and that the international system in dealing with these emergencies was robust. Another review of the first 4 declarations, with the exception of wild polio, demonstrated that responses were varied. Severe outbreaks, or those that threaten larger numbers of people, did not receive a swift PHEIC declaration, and the study hypothesized that responses were quicker when American citizens were infected and when the emergencies did not coincide with holidays. Non-declarations. 2013 MERS. PHEIC can also make the news when it is not invoked, as has been the case to date with MERS. Originating in Saudi Arabia, MERS reached more than 24 countries and resulted in more than 580 deaths by 2015, although most cases were in hospital settings rather than sustained community spread. What constitutes a PHEIC has, as a result, been unclear. Non-infectious events PHEIC are not confined to only infectious diseases. It may cover events caused by chemical agents or radioactive materials. The emergence and spread of antimicrobial resistance may debatably constitute a PHEIC. Microbial resistance may debatably constitute a PHEIC. Microbial resistance may